أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم سبحان ربك رب العزة عما يصفون والسلام على المرسلين والحمد لله رب العالمين إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا عليه وسلموا تسليما صدق الله العلي العظيم. Dear all, Assalamu alaikum. Hope all of you are fine, and I hope you are in good shape. And I request, where you people are praying for your elders, you should also pray for your teachers, and also for those people who has made this whole arrangement for you to study over here, one of the best places to study. And also you have to pray for the eradication of this viral disorder which has engulfed the whole world. So after that we come to our pharmacology. Again, as usual, I say the whole pharmacology, what we teach over here, it is important. And you can't regret to your patients that I had not studied CNS, or I had not studied about the medicines to treat, say, the this salmonellosis, typhoid fever, or the enteric fever, like that. You can't have 100% knowledge, but at least you should have some approach to a disease. You should be able to guide a person if you are not in position to give your expert opinion. Coming to this topic, it is about the worms. You know, all familiar with worms, very common even in our country. Previously, the names were given about the Dera Ghazi Khan and Sialkot, but I have gone through certain cases even in this Lahore, a so-called posh area of the country. So it's something very, very common. These worms, how many of you have seen the worms? They have different shapes, and the topic about the worms, it is well taught there in your pathology, parasitology, where you see different worms. Over here, we will talk about certain medicines. Because of their great importance, let us talk something about the importance of it. So in your small booklet of pharmacology, it is written that 1 billion people in the world, they are suffering from nematode infestation, nematodes. And out of those nematodes, 500 million, and they are suffering from tissue nematodes. So this is one statistical approach about the importance of these worms infestation and their treatment. And another one, 1/4 of American population is suffering from one or the other type of the worms, maybe intestinal or maybe tissue, affecting tissues. So if 1/4 of the American population is suffering, so you can well imagine about our own country where I see, I say that maybe even 100%. So in routine, what you are supposed to do, you must take some medicine to eradicate, to eliminate these worms, say after 3 months, like that, or around it. So whenever you are treating, say, the families, main people who are affected, they are from poor environment, unhygienic environment. But even I have seen people living in posh areas having good food. They are also suffering, and they produce certain complications. Number of them, mostly related to GIT. They may migrate from GIT to these worms may migrate from the other organs like the liver may go into this lungs, they may go into lungs and other parts of the body into tissues. So in routine, most of the drugs which were prescribed, which were used for, they were harmless to human beings. Not only for the application of these drugs to eradicate the worms or to kill them. If we say to kill them, they are known as vermicidal. Vermicidal. Worms are to be killed. Vermicidal. Another group is there about these drugs, that is vermifuge. Vermifuge. The worms, they are paralyzed and they are thrown out of body through feces. Vermifuge. When we say vermicidal, they are killed inside. But the medicines which are used, they are more, they are harmful to the parasites and as compared with their side effects on the human beings. So two main, the previous classification about this was the vermifuge and vermicidal drugs. So after that, how they are classified, and this is another way. The drugs to treat the roundworms known as nematodes. Nematodes, about which you have been told that 1 billion people. What is 1 billion? So Mr. Sharkey will, and also Dr. Khushbakht will, they will tell what is 1 billion. So they are treated like this. The drugs for nematodes are the roundworms, and the drugs for trematodes. Trematodes. These are flukes. Flukes. Liver fluke, maybe liver fluke. Other flukes are lung fluke, like that. Intestinal flukes. And other group is the drug for cestodes. Cestodes, tapeworms. They are also common in areas where there is no clean water, unhygienic condition. So these tapeworms, very important to note. You study these. These are also tapeworms. The infection due to tapeworm are also known as teniasis. Note down, please. Have a pen and a copy with you. Teniasis. Over here, teniasis is TAE. Teniasis. Another teniasis is fungal issue. That is TIN. This question is asked in your Bible. Teniasis. So these worms, the cestodes, they may be small in size, like Hymenolapis nunna, and they may be even in meters. So something very, very important. So whenever you are going to treat a patient of a family. You should treat the whole family. Mind it. They produce effects because the disorder is long-standing. Whenever you see some anemic person, go through that, and you can, I would like to say over here, a person is in some area, say slum area, or unhygienic conditions. So you can give these drugs, the anti-helminthics or ant-helminthics. So you can give these medicine even fi sabilillah. Just give from your own pocket. If you find that the person can't afford, usually these medicines they are given once, and just one dose is sufficient and may be repeated after 15 days. In certain cases, resistant cases, say given for 3 days or given for 7 days. It depends upon the severity or the susceptibility of the worm. So this is about the overview about the worms infestation. Just so medicines, because of their good history, is there. More than 100 years back, medicine they were introduced and used in human beings. Not only in human beings. In other, say in poultry farming, is something very important. Regularly medicine and give. Persons who have dairy farms, they use these medicines in routine. When the animals they are losing weight on that. So these worm infestation is common not only from human being side but also in other animals. For birds they are given to eradicate the worm, to kill them. Because of their good history, say more than 100 years, number of older drugs just you can note down is to get more mass in your viva. If not, they are abundant. The older drugs are abundant because of their certain side effects. You can just note down, say, written over, I'm going through one, which is like the thymol. Then another one was carbon tetrachloride. Carbon tetrachloride, that was toxic, and main indication was for hookworm. Another drug, older drug, oil of chenopodium. Oil of chenopodium, just note down. Then another drug of historic importance, that is gentian violet. Gentian violet. It is dye. Then another one is Santonin. Next is Expedium oleoresin. Expedium oleoresin. Then certain antimony salts they were given, but because antimony heavy metals they have their own toxic effects, so also abundant because the safer drugs they were introduced. Then among the older drugs, let us see, there is one which was of the as concerned the history, that was the first one to be used for worm infestation. It is hexyl resorcinol. Hexyl resorcinol. Note down hexyl. It is phenol derivative like your chloroxylenol. This hexyl resorcinol, it was broad spectrum. Broad spectrum means covering number of worms. Say the round worms, say the tapeworms, like that. hexaresorcinol. So then among the older drugs, because of the safer drugs introduced later on, so these drugs were abundant, and now you may have some knowledge about this one drug, Mebendazole. So we will go through these different slides. I mean, these drugs are from different chemical groups. What you have to remember, this is the drug, say the drug of choice for a specific worm, and this is the worm. Or this worm is eradicated by this. Both way you have to remember. I had asked during one viva from a daughter student. So how do you find this pharmacology? Because it is something very, very rare that somebody is interested in this topic. So she was one of those few people who replied that sir, once going say 2 or 3 times, so it becomes interesting and it's not difficult to remember it. Well, anyhow, she was the one of the rare students who encouraged me to keep on teaching this pharmacology. Then we come to this slideshow. Next, here the learning objectives. Learning objectives. So you will be asked what medicines are for nematodes or the roundworm, what are for liver for these flukes, nematodes, and what are for cestodes. And how they act. Here just I gave you something broad mechanism about how the drugs act. The drugs they act differently. Drugs they act differently. Say one drug that paralyzes worms. Paralyzes worms. Paralyzing may be even the paralyzing may be of two types. There may be spastic paralysis. There may be paralysis like that of curare. Note down curare myoneural junction. So then the certain drugs they act on the microtubules formations, while the other drugs they interfere with the metabolism like that oxidative phosphorylation. So there are different ways. Glycolysis is, stop, and different ways are there how these drugs are acting and whether they are vermicidal. So when those drugs which are vermicidal, in general you should know, their disintegrated parts, they may produce reaction in the body. Reaction in the body. They may produce different kind of reaction in the body. So when you give, say, you paralyze the medicine, then you give some purgative to throw these parasites out of body. There are these mechanisms. At some places these mechanisms are unknown. Anyhow, with the medicines you will be told about it. Then after that, among the learning objects is clinical application. So medicine used for worm infestation, they may be used even at certain other places. And as far as the toxicology, adverse effects or the toxicology, note down. Hope all of you are there to listen it. Toxicology, this is, because of their use, say for short period, So the adverse effects are usually not that very serious. So anyhow, you should know some of them. Next slide. Overview. Again over here, the worm what are the worms? They are multicellular organisms. Roundworm, flukes, cest tapeworm. So these are multicellular organisms. They cause a broad range of diseases. Over here it is 1.5 billion. I was telling you about the nematodes. 1 billion people are affected, and uh, uh, 5 billion people they are suffering from nematode affecting the tissues. Here one word is written helminthiasis. Who are affected over here? Tropical or subtropical? Low income group. You have been already told. But at the same time, I am telling you, I had gone through one literature. 1/4, 25% of American population also suffering from it. Or over here, you can well imagine 100%. And you should take these medicines, say, after 3 months like that. Give to the children. Take yourself. Give to wherever you see some people living in an unhygienic environment. This is one picture. The most red side is where it's a public health problem. Red side. Here you see uh, Africa is there. Then Pakistan, Afghanistan, India, China, Bangladesh, like Malaysia, etc. Then even in South America you see is very common. This is one picture map about the intestinal walls. Then or we continue. Children, they are infective at the time of birth and may remain so throughout their lives. Mind it, something very important. Whenever some child is pale, not you find some not irritated, he has some abdominal discomfort, even there may be blockage. So he must be given medicines to eradicate it. Anemia is there, nutritional problems, cognitive impairment may be a problem one, common in helminth infected children. Then helminthiasis is often co-endemic. They are going side by side because of these tropical disorders, malaria, tuberculosis. These HIVs, these are diseases. Here you see even of the modern environment. And they are also side by side. These problems are there. Tuberculosis, HIV, AIDS. So the overall burden that increases of the morbidities. Here is the way, how the disease is being communicated. It is the well known when you take food or you drink this water and the worm, the ova, and it's like that. They are transmitted through animals. Here one rabbit is shown, doggies are shown, and so communicated to human beings. Next. One broad classification, medicines for roundworms, nematodes, cestodes, you have been told about it. Then approximately 20 helminth species are considered to be clinically significant and fall into two main groups. 20 Helminth species are considered to be clinic. Intestinal walls. Living in host alimentary canal. Here the names of different walls are given on left side, intestinal walls. So well, on left side you study this Ascaris lumbricoides, Ascariasis, and known as Ascariasis, and then Antrobius vermicularis. You should also remember the local names of these. These are the zoological names. Then Trichurus, Trichiuria, maybe Whipworm, Strongyloides, Stercorales, Nicator americanus, Ancylostoma duodenale, Ancylostoma hookworm maybe. Then among these ones there are Taenia saginata, Taeniasis, Solium, Hymenolapis, Diphyllopatrium latum. Then extraintestinal walls in the host, other tissues which are schistosomiasis. On right side here, sorry, Hematobium, Mansoni, Japonicum. Trichinella spiralis, Dracunculus. So you should remember because you study in pathology. Here you study what are the medicines and where to give. Eukaryaria, Bancrofti, Loa Loa, Onchocerca volvulus, Brugia Echinococcus granulosus. You might have heard about hydrated cyst. These are the different few names about the different worms. Relative incidence of these worm infections worldwide. At the top, here at lower side, you see the nematodes, maximum, then the hookworm, then Trichurus, then Filariasis and Trobius, then Schistosomiasis, then tapeworm. It's given very low incidence of the tapeworm, but it's common in our certain areas already. You've been told, say tapeworm in Dera Ghazi Khan and that Sialkot. Then Strongyloides, Trichinella. This is overall their prevalence. Then here you see some pictures are given. On right side, cestode, Echinococcus tinea. Further, there this number is given, cestodes more than 100 million. Then Ancylostoma duodenale, Nicator americanus, and number is also given. Not very important to remember. It's difficult to remember all these numbers. Anyhow, their pictures are given. At lower, the Trichinella spiralis, Trichurus, Trichiura, then Ascariasis. On left side, Progia, Melaya, Onchocerca, Volvulus, Eukaryaria, Bancrofti, Schistosoma mansoni. Next, please. Because of their prevalence, economic significance, the pharmacological treatment of worms is therefore of great practical therapeutic importance. Why the importance is given over here? How to treat them? The different terms used, deworming. The common word used over here, deworming. The worms are eradicated, the worms are killed. Their number is few. Vermifuge, they are thrown out of body, and vermicide, they are killed. Then worm, this picture is there in your mini caption. So for the nematodes or the roundworm, left side you see Alpentazole, diethylcarbamazine, ivermectin remain very common in this. You see the corona. It was tried. Some people said it is something very important, very effective. Ivermectin is also for these lice lies, and at the same time it is anti-helminthics. Then mebendazole, then parental pamoate. This parental pamoate, well known by the name Combantrin, remained very common, though almost replaced by Vermox. Then drugs for nematodes. Here you see bithionol, metrifonate, oxamniquin, and praziquantel. Praziquantel is a different pill, so you must go through it. Drugs active against cestodes, Tavol. Here you among these four drugs, niclosamide is the oldest one, niclosamide, 2 tablets given before food in the morning, then 2 after 2 hours. Niclosamide, it remained very important. Then praziquantel, broad spectrum, then mebendazole, albendazole, they are cheaper, and nowadays their importance is there. Next, please. How they act. This is something general mechanism. By paralyzing. You have been told paralyzing by 2 times, maybe spastic, maybe like Corona-like. So one way is the paralyzing the parasite. Second one is the worm is damaged. The immune system, say working on, that may eliminate it. Then to interfere with their metabolism, you have been told, with the microtubule, interfering with this oxidative phosphorylation. Next. Here about the nematodes are, what are nematodes? Elongated roundworm. Complete digestive system is there, cause infection of intestine as well as the blood and tissue they meant. You've been told about it, that 0.5 billion people they're suffering from this nematode. Intestinal nematodes already discussed with some way. Then tissue nematode on right side, Trichinella, Trichinculus, Ocraria, Bancrofti, Loa, blindness, Oncos, Cerca volvulus, Brugia mili. These are few pictures of these ones, how beautifully they are displayed, but very harmful, so don't go on beauty. Here you see the hookworm on right side, and whipworm there is in local language. Whip is known as chanta. And then left side pinworm. When pinworm is treated, it is treated say for 7 days, and the whole family must be treated. Then tissue nematodes, Trichinella, Spiralis, Wuchereria, Pencrofti, cutaneous larva migraine is there. Then Onchocerca volvulus, nicely collected by Dr. Paracha. Thanks to her, assist me in arranging these. Then here you see one very important drug, benzimidazole carbamide. You have to concentrate here on azole. These azoles are at different places, say metronidazole, itraconazole, ketoconazole. So you have to concentrate on it. Benzimidazole carbamide. Well, the drug is given orally, absorption is increased with a fatty meal in the liver. Liver function should be updated to detoxify the drug. This albendazole, it is converted to active metabolite albendazole sulfoxide. That distributes well to tissues, human tissues, the tissue tissues, and enters bile. Also CSF, and also very important, hydrated cyst. Here you see the sulfoxide, albendazole sulfoxide is formed. So the distribution is wide, going into tissues, going into bile, going into CSF, then into even the hydrated cyst is treated. Half-life 8 to 12 hours. Albendazole metabolites are excreted in the urine. In case of hydrated cell lengthy treatments are there when the tissues are involved. Albendazole metabolites are excreted in the urine. Next, about albendazole. It is MOA mechanism. Albendazole. How it was. It interferes with the microtubule formation. The drug is larvicidal. Initially, you were told that some are fugal. Some drugs are vermifugal and some are. This one is larvicidal in ascariasis, roundworm, cysticercosis, hookworm, and hydrated disease. And this drug is also ovicidal, larvicidal as well as ovicidal, bendazole in ascariasis and xylostomiasis and trichuriasis. So it's broad spectrum. This drug is broad spectrum. Then again written over here is a broad spectrum given empty stomach against intraluminal parasites, those parasites present in your gut, but with a fatty meal against tissue parasite. Albendazole. Its name is. It is a primary drug for ascariasis. Again, repeating over here, it is broad spectrum, hookworm, pinworm, roundworm, whipworm, they are killed. Given to adults and children for more than 2 years of age, and the dose is 400 mg once a day for 3 days. Once a day, course is for 3 days for hookworm. Also 400 milligrams once a day for 2 weeks for pin. Here I was already telling you about pinworm. Here lengthy treatment is required. Also very effective hydrated cyst. Here you see the duration of this. Drug is given BD or BID, note down BID, Bisendai, note down please. Hydrated cyst. So given for 1 month. Then in case of neurocysticercosis, it is given for 21 days and corticosteroids. Why corticosteroids are added? Note down. To avoid the reaction by the dead fragments. Then at 4 here you see for cutaneous and visceral larva migrants, albendazole is effective. It is a drug of choice in intestinal capillariasis, microsporidial infection, and nathostomiasis. Here, drug of choice. You must remember where this albendazole is. Then clinical use still going on, active again even in the stenosis or the cestos, trichinosis, clonarchiasis, opistarchiasis, toxocariasis, these are loiasis, loa, you have studied loa. Lymphatic filariasis, giardiasis. As empiric therapy, note down what is empiric and what is rational. Empiric therapy to treat those who return from the tropics with persistent unexplained eosinophilia. It is empiric, based on empiric. Whenever our guests or people go from here back to America, they are asked about it. What different places have you visited in your country? Toxicity albendazole nearly free of significant, and the main toxic effects are not there, mild and transient. So the GIT disturbance may be headache, dizziness, lethargy in some way. Long-term use, abdominal distress, headache, fever, alopecia, enzyme in liver enzyme, pancytopenia. So when the medicine given for a very long time period, where not to be given. Contraindications. People are allergic to it. Are they allergic to azoles, benzimidazole? Does, in case of liver function is not up to date, cirrhosis there. in pregnancy age, children less than 2 years, it's something general. You have to be very careful during pregnancy, or the medicine given to children, you have less than 2 years, you have to be very careful. Here onward, your next teacher will continue it, inshallah. Thank you very much. Hope all the best.